Infrared imaging, medical thermography applications. We're talking about the new camera devices that is actually being used for medical applications to understand disease, diagnose them very early, and to improve the health of patients. This is just an introduction, so we can show some of these in a session. Survival rates as well as the quality of life following treatment are typically inversely proportional to the extent of disease diagnosis for the more prevalent sites for disease. In short, patient delay in seeking a cancer diagnosis is an important problem, and in addition, it's a behavioral problem, sometimes unable to psychological. Patient delay refers to the period between an individual's first awareness of a marker of illness, signs of symptoms, and medical consultation and diagnosis. For example, in cancer, delay in seeking a diagnosis often increases morbidity and mortality. That is, if one delay is less and the disease is less advanced than diagnosis, the likelihood of cure may be increased, or at least the interval between initial treatment and recurrence, called disease-free interval, may be lengthened, especially in cancer. Lack of diagnosis allows disease progression to more advanced stages and mortality. Traditionally, the use of narcotic analgesia in patients with chronic pain, for example, had been discouraged until a definitive diagnosis could be made. Concerns existed about analgesia making patients unstable, hindering subsequent physical examination, and ultimately delaying a definitive diagnosis. Although pain is a part of life, there is much that doctors and other healthcare providers can do to reduce the severity of acute chronic pain. Pain that is persistent, severe, continuous, or intermittent can destroy the will to live and interfere with adequate treatment when it is not controlled. Chronic pain has its roots in social behavior and norms. People with painful conditions tend to be generalized in the same term as street addicts when it comes to decisions that govern their ability to receive an appropriate treatment and pain-relieving medicine. While the street addict who is psychologically sick and abuses drugs for recreation, the really patient in pain is psychologically healthy and requires medicine and other measures as long as his or her life symptoms remain. The solution: clinical surveying. But how surveying is surveying in clinic? We need methods that can expand our clinic capacity. The traditional tests used to diagnose painful conditions include X-rays, magnetic resonance, called MRI, electromyography, and nerve conduction studies. However, tests that are often performed in pain management centers are directed toward eliminating or reducing pain as an endpoint, but they are not sufficient of diagnosing 86% of all the cases. It's so much people with pain and no specific diagnosis. So, the sympathetic nervous system has been shown to participate in many pain conditions. Infrared is an advanced clinical evaluation. Not infrequent after a pre-existing injury, the sympathetic nervous system participates in many pain conditions. This is recognized through appropriate diagnostic testing as thermography. Thermography can help the physician to see and study the type of pain and its. You can believe what you see. So, take pictures showing it, make people believe that he has a problem to be solved. For example, the stars, we believe that it exists, but no one ever went to there. The infrared imaging, thermology, is older than pyramids. Hippocrates, of course, was a physician 400 before Christ, and he used it in the past. Put mud and see where the place it was drive very more fast than other places. And he wrote, where there is excessive heat or cold, illness is there to be discovered. It was the first thermography exam. Some snakes can see not only by visual image but adding infrared imaging, and they can have a better advantage of other animals, so they can see in the dark rats, their food meters away, so it's an advantage to see in. This was observed by the militaries in the 60s, so the military application was one of the most popular and developed application. So thermography is the capacity to picture the heat, and it gives us a great advantage from the others when you have this sensibility to see in the dark. So infrared is made with a device, camera, that does not touch the patient, there's no radiation, and it's totally secure. It only pictures and make a move of the heat pattern of the skin. The sensors and cameras are very have a high technology today, and they are not so little equipments, but with a high definition, high precision, and specific for medical today. Here is an example of a normal woman body. Is a total full body thermography showing the heat pattern of normal body. We can see in the head hot colors, the hot places, and the cold places in blue and purple. So the distribution of heat is proportional and symmetrical in the body. We see the hot spots and cold spots distribution, and we understand how the metabolic activity is. In 1982, the FDA approved the application of thermography in medicine. In our country, Brazil, it was recognized as a medical diagnostic tool with a specific code, medical code, in 1999. This was published by our group in this journal, Vascular Journal. So it's a medical diagnosis. But different from nuclear medicine, radiology, it has a specific condition. Radiology, the equipment is the source of radiation. In nuclear medicine, the patient is the radiation source. And in thermography, the patient is a natural source of radiation. It's a complex evaluation, but very similar to medicine nuclear without ionizant radiation. The use of thermography had a spread all in the world in the detection of patients with fever in the airports. It was a very important medical application in order to not to allow the spread of infection disease between countries. So it has a very impact on medical field, this application in public so infrared imaging is a means of diagnosis without contact, contrast, no radiation, no pain, totally secure. It allows to evaluate the microcirculatory activity by mapping the distribution of skin surface temperature. The thermography has a very different evolution from other exams. For example, X-ray, it was explosion, the discovery of X-ray as a means of diagnosis in 1895. Tomography and MRI have the same explosion and spread in the medical field because they are anatomical exams and very easy to understand the image. The ultrasound and more recently nuclear medicine as a functional exams, they are more difficult to understand and to prove that they are very efficient in diagnosis because are functional exams. So thermography has the same similar history. It starts in the 60s, but only today it's possible to understand the importance of this technology in medicine. So understand difference of anatomical exams and functional exams. Radiology is an anatomy view of the structures, and nuclear medicine is a functional view, and thermography is also anatomy, but especially functional view. It's the same here, the same disease, osteoarthritis, but it was observed in different methods. Nuclear medicine, first image, second in the X-ray, and the third in thermography. So the same disease with different aspects. It's very important to understand that infrared imaging is a metabolic imaging. It's the imaging of the metabolic activity of the structures, any structures of the body, as the muscles, which the trapezius and the cervical posterior muscles, in high activity in the right shoulder of scapula of this patient. And you can observe that our image has a specific color grade scale for us to understand how much is this metabolic activity. So it's possible to change the scale and study the spread and the thermal distribution of this metabolic activity. So the image, no all images are the same. It's possible to change and understand this activity with some softwares and specific color paths. So we have different medical operating modes for thermography. Infrared cameras and low current exams with 4 basic modes of operation. Anatomic evaluation and for functional evaluation. For anatomic evaluation, we have monochromatic scales. The most common are grayscale and iriscale. It could be inverted gray or inverted iron also. We have the vision fusion, with fusion above or defect of lip with 3D. That is a multispectral imaging called MFX, and morphologically using contour 12 and contour rain camera. And for the functional evaluation, we have the color palettes, high contrast and need, and also with vision fusion. That's monochromatic with color isotherm scale. We call this with rain, mid, grain. So here is an old picture, but showing a high definition image of the eyes. Here we can see the lacrimal in the eyes with the inverted gray scale. Here's another example with a high definition image in the gray scale or in an anatomic mode, and it's possible to see the glands, the sebaceous glands of the thumb in this case. It's another case of anatomic mode in the gray scale. So this is not a visual image. Understand this? It's a thermal image of the eyes, the upper lips, upper eyes. So all these pixels are thermal information pixels. And here's the modern thermography using the monochromatic anatomic mode, but plus with the 3D, the MSX mode. So here we have much more details of the eyes, the mouth, the nose. We have the deep effect, and we can understand better the distribution of temperature and the anatomic aspect of but thermography is essentially functional, so we use the color image here in this case together with 3D And it's possible to understand that we have a much more flux of circulation on the right left of this patient than on the left. This is a patient with migraine. Migraine has a disturbance of vascular distribution in the supraorbital territory, artery territory. This is another case that we are using the functional mode with a color isotherm with a monochromatic grayscale, and it's possible to understand the anatomic and functional aspects of this problem. This patient has a very significant difference in the temperature of the inner canthus of the eyes, is the territory of ophthalmic and the carotid artery territory. So he has a flux is much less in the right than in the left side. So we have in the right image the same aspect using a red isotherm. So it's possible to measure the functional physiological effect of a carotid stenosis, for example. But it's necessary to understand the anatomic aspect, but not with thermography. In this case, with ultrasound, Doppler exam, and eventually with clinic. In the breast disease, breast studies, we can use thermography to understand the metabolic activity of glands. And breast gland is a superficial gland that is much easy to understand the metabolic activity, but using the correct tools. It is possible to understand that the left breast has much more activity than the right. It must be correlated with the clinic and other exams of this patient. We can also put a visual image together with functional images. This is a functional of visual and function in thermography, and really understand where is the place that we have a high metabolic activity on the. But thermography is not only take a picture, is also make moves, and we can make provocative tests to create contrasts and to understand better how is the metabolic activity of some disease. In this case, breast cancer on the right breast. So it must be correlated with clinics and also other exams. But the metabolic evaluation is possible with infrared. In this case, using a fan that makes much more contrast, and with a cold provocative test is possible also to see that the image, the hotspot irregular hierarchy distribution is not changed with fan if provocative. With thermography you can evaluate the same disease with different tools, so it's very interesting these different aspects of new tools, medical tools that is being introduced for medical thermography evaluation. So 3D, different functional palettes and monochromatic palettes are giving us a better understanding of the functional activities. This is another very interesting application. That it's cardiac surgery, open cardiac surgery, and in this case it's possible to use thermography with a camera 1.3 meters away from the surgical field, so there's no interference with the surgeon activity, but it gives a very important image. For example, here is the vision of the surgeon. He's doing anastomosis between the safena and the coronary artery. But after his clamping the artery, it will not be possible to see the perfusion of the heart. But with thermography, this is very different. It's possible to see the perfusion of the heart in real time and see that there is no obstruction in the coronary artery that was not possible to see in the last image. So here we have we gives a response to the surgery that the surgery was okay and it was a successful surgery. See that our contrast here is the blood, the term or the temperature of the blood. So it's very amazing and very impressive this vision and gives a very important information for the surgeon. So if you can do this in cardiac surgery, imagine with other medical applications. Here, for example, we can use thermography together with traditional exams like MRI, angiography, tomographies, and understand the anatomical and functional aspects of the disease using and not blocking the other ends. So thermography, there's no limits. Here's another study that we're using at Brazil, developed by our group, that the 3D MRI thermography, that we can have the best resolution in anatomical resolution with MRI and the best physiological information with infrared. So this is the future. This is the reduction of anatomical and physiological exams in only one exam. So thermography is a great future as a functional exam, different from the past when it was used not in the correct way. So thermography is very important for medical applications nowadays. We can so understand the anatomy and physiology of the disease, but it's necessary to produce a report. It's necessary to make a description of what you're seeing, to make a diagnosis impression, to give a response for the patient, for the physicians, for what is happening with him. So it's necessary to give a scientific report, not only take pictures, but give us some information that really give a difference in the treatment or in the prevention of the patient. Not only a heat information of heat or cold area, but are these, how this can be interpreted. So it's very important to the report, a medical report, specifically and medical report in thermography applications, because other aspect is the legal medical aspect. So this information has and it must be do with medical responsibility. For these reasons, we have this methodology thermography available at main Brazilian cities. The main city actually is in São Paulo, where we do some of the experimental and some researches with infrared at São Paulo University Hospital, but also in the practice, medical practice, in Sírio-Libanês Hospital, 9 de Julho Hospital, doing medical reporting, helping the physician, helping the patient to understand their problems, and, to understand the cases when you don't have a good diagnosis, a diagnosis very clear. So it's possible in all the cases with tomography do a full body evaluation and understand not only the main disease but secondary disease that are together with the patient, that are developing with the patient. So it's possible to do the preventive medicine, but at the same time to do the primary medicine, tertiary medicine, doing the response and give a direction for the treatment of the patient. thermography can light the medical conduction. But again, infrared image is not only to take pictures, must have a radiological interpretation. So the specialist who works with infrared imaging should be aware of infrared physics, instrumental familiarity with these new equipments and new resource, and knowledge of anatomy and the new physiology of functional aspects of the diseases. So there's a lot of things to study and understand. The conclusion is that thermography is completely safe. It is very, very important. So I can repeat this with no damage to the patient. So I can understand and repeat this to clarify the ideas of the diagnosis. It's a functional and a metabolic assessment. It is very important. That is a new tendency of the exam today, and is essentially is advanced medical propedeutics and clinical workup. So thermography must be done with the clinical evaluation. We must understand the light, understand the wave, the infrared, the long infrared light wave, and to have the vision of disease, to have the vision, the infrared vision of the functional disease. So the main of all of this is to help the patient, to give him more health, to prevent disease, to promote the cure, and to help the physicians to understand what's happened to the patient. It's not to substitute other exams, but to join them against the illness of the humanity. To understand all this is not easy, so we have developed some medical course. We have developed the advanced medical thermology course. Today course very immersion course based on the international consensus and guidelines of medical thermography that was sponsored in Brazil by Professor Ring, me, and Professor Manuel Jacobo Teixeira, that is the neurosurgery chief of São Paulo University, and we create some medical aspects that must be spread, and we spread this and teach this on the EM course. It's a 2-day of immersion course that we talk about the initial attendance of the patient, thermoregulation, metabolism, how to prepare the patient, how to prepare the lab, how to a quick start with thermovisuals, softwares, positionaments, clinical cases, and also how to evaluate musculoskeletal, oncological, vascular, neurological diseases, and how to do provocative tests, and in the finish the reports and the ethical and legal aspects of thermography. So it's a very intensive course and very interesting for the people to develop thermography. It's organized by the São Paulo University and by InfraredMed, and sponsored by the Brazilian Thermology Association, that actually is linked to Legal Medicine Brazilian Association. We can find this on thermology.org courses and www.abraterm.com.br.